activity you do at schools. We do not restrict their creativity, so what we do is we try to get grants. Year in, year out, it's not easy to get grants actually, especially for advocacy, but alhamdulillah for the past 5 to 6 years, we managed to secure grants. So no matter how little we get, we try to maximize whatever we can do with that little money we have. And of course, we have to collaborate, because collaboration is very important in advocacy. Many parties or NGOs are very, very active in doing advocacy. So find your friends in advocacy, work together with them, because you cannot work in silo. You have to work together because this is a national problem, it's a worldwide problem, okay? So, yeah, when you have trained the students, okay, your trainers, then they are empowered. We have sent our students actually to the parliament to chase after the members of the parliament to send a GEG for a petition a few years ago. And I was very proud of them because they were supposed to go only half a day, but then they insisted to stay until 7 p.m. because they targeted a few more members of the parliament. So I was very proud of them, and although the GG was still dropped after that, but it's okay, it's the effort that matters. Okay, then following programs, you have to actually either advertise it or publish it. So you have to write in the papers. You make your students write in the papers. So this is one of the examples that was written by my student. We vape tar to get high. Why did we say that we vape tar to get high? It's because a group of students actually went to the roadside and picked up some tars, you know, the tar, the black tar. They smash it into very, very fine yeah, so they smash it, they put it in the vape juice, e-juice. When we ask them why do they do that, it's because they don't have money to buy alcohol. They want to buy alcohol actually. They don't have money to buy alcohol, so they do that to get the effect of mabuk, the high effect from the alcohol. So that's how creative these people are. And we have to keep on talking to these users so that we know what are they doing to themselves that we do not know. Then you can talk better during your advocacy, you can give examples during your advocacy programs. Okay, so it was very, very shocking to us. So that's why we wrote that in the paper. We also sent our advocates to appear on the television and also the radio so that they become very empowered. They know that we trust them. Once you have trained them, you have to give them a lot of degree of trust, because you know they can do it. When you just send them anywhere, they can talk about it without you being there. So we have got students who have graduated from University Malaya. They even conduct their own program without us having to guide them anymore. So that is the impact. When you do advocacy programs, there must be an impact. Sometimes they may not report it back to you, but you see it in the newspaper or in bulletin, you can consider it as an impact. You have taught them something, it's a long-term sustainability thing. You don't give them money, of course you don't, because you don't have enough money, okay? Now, why do you do all this advocacy? Because you want to create a smoke-free environment, smoke-free schools, because these teenagers actually vape in their classroom, in front of their teachers. So it is getting out of hand. They don't smoke the cigarette smoke because it has got smell. But the teachers can be easily disguise, they cannot detect the vape smell. So they do it in the classroom. So we also want to create smoke-free families and homes. So what are all this for? Hopefully to achieve the end game 2040, which is the prevalence of tobacco smokers less than 5%. So with that, I thank you.
Such an interesting talk. Boss, it's very hard not to ask questions. I have a billion questions for you already. So I have a billion question for you already. So I'll ask later, but I will try to not to. Yes.
But there are so many stories we could share about what actually people and teenagers could do actually to feel high. It's even more risky and deadly than this. So unfortunately, yeah, we need to protect our future, which is our, the upcoming young adult that we have. So it's my pleasure now to introduce that Dr. Ramli. We are honored to welcome her. She's a consultant physician and head of early detection and cancer prevention services and Jirudong Park Medical Center in Brunei, which is cancer center in Brunei, with extensive clinical and leadership experiences. She established Brunei's first dedicated cancer screening center and has led national efforts in cancer education, detection, and genetic screening. Her passion for health literacy and community empowerment makes her a true pioneer in advancing cancer prevention. Today she will share Brunei Darussalam journey in reducing its national cancer rate. Welcome.
Thank you. Thank you to the NCCM for inviting us. Brunei Darussalam being as a first time joining in this conference. I'm Noraslina. I'm actually, my background is also a family physician. So we'd like to share about the overview of our cancer control landscape in Brunei. So this is the content of my lecture. So just to share with you, actually Brunei is a very small country. This makes there's some challenges with being a very small country. We have a population of just under less than 500,000, and we are divided into 4 districts, where the smallest district is actually the most densely populated, which is Brunei Mora district. Our health and education are free. Our cancer burden is actually in par with the global burden of increasing cancer incidence, and 1 in 5 deaths are due to cancer in the last decade, and 1 in 3 Bruneian men and 1 in 3 Bruneian 1 in 3 Bruneian women and 1 in 3 Bruneian men will be diagnosed with cancer in their lifetime, and 70% of our breast and colorectal cancer are actually diagnosed at stage 3 and 4. So this is just to show you from our data from the Brunei Darussalam Cancer Registry that over the last 2 decades that there has been a double, twofold increase in the number of new cancers for both men and women. So like most trends in globally, our top cancers for men are colorectal, prostate, lung, liver, and lymphoma. But what is interesting also at the moment that we are finding that our incidence of lung cancer is actually reducing in Brunei. The top 5 common cancer for females are actually breast, colorectal, and ovarian cancer. And we're also finding that the trend of our cervical cancer is actually now going down. So this is just to compare with you our age standardized rate and age standardized mortality rates for all cancer for men and women, which shows that actually more women are actually being diagnosed with the incident with having cancer, but actually there's more mortality occurring among our men population. So other factors that contribute to our cancer burden is actually lifestyle changes, more of the adoption of our Western diets, sedentary behaviors, for example, lack of physical activity, high prevalence of risk factors like obesity and tobacco use. About almost 30% of our adult population are actually smokers, and about 30% also for men and women are actually obese. And there is also a problem with the aging population which contributes to our burden. It is estimated that in 16 years' time, our 60 plus age population will be doubling in Brunei Darussalam. Okay, these are just to show you our key milestones. This is just a timeline of
the progress of our infrastructure and our screening program. We are one of the first countries to have a 100% uptake rate for hepatitis B vaccination in Brunei. And also our HPV vaccination program, human papillomavirus vaccination, has been incorporated into the school health program, in which we have achieved almost 97% uptake rate. Next one. This is just an overview of our cancer control in Brunei, in which involves policies, guidelines, and involvement of multi-sectoral committees and also services. One of the main ones, I'm sorry, it's a busy slide, but one of the main things I would like to highlight is that our tobacco control program, since 2004, we have made it illegal to sell tobacco in Brunei. So, and also in 2012, we have also reinforced on the, on prohibiting smoking in the public places with fines. And the other thing that helps to, which we think is one of the things to lower our NCD as well, is the introduction of tax on the sugar-based drinks. And in 2019, we have we have rolled out our national health screening program for NCD, which also includes breast cancer and colorectal cancer. So that is under the population-based screening, which is under the Ministry of Health, and it's free to the whole public. This is just to show to you that the Brunei Darussalam National Multi-Sectoral Action Plan, we do not have a National Cancer Control Plan document as yet, but guided on this, which we have two versions. It started in 2013, where initially we have incorporated NCD control, which includes reducing cancer risk as well. So this is actually a government document. We have a whole of nation approach towards control of NCD, which is actually led by the Ministry of Health and the involvement of many multi-sectoral stakeholders, which helps to which actually helps to promote and also and ensure the efficiency of the tobacco control program, including advocating for physical activities, and also this the involvement of all this multi-sectoral committee as well will help to give those in power to help reinforce the tobacco control plan, and also those things that are related to the NCD control. This is just a paper to show that because of the survival benefit of early detection and cancer screening, the government has actually put together its national health screening program, and it's been formalized and launched in 2019. Brunei Darussalam actually has a high incidence but lower mortality for breast cancer, and and we have a 70% survival rate for breast cancer in Brunei. This is due to the ongoing cancers like mammogram and awareness and advocacy programs that we're doing. Next one. So, in terms of cervical cancer, we are one of the first adopter of the Pap smear test, and we have now reached almost 70% of our 30 to 49 population, women population, getting their Pap test. Next one, please. So this is the National Cancer Screening Program, which is actually officially launched out by the Ministry of Health in 2019. Specifically for targeting colorectal cancer, breast cancer screening, and cervical cancer screening. Cervical cancer screening has actually been there since 2011, but the uptake has been very poor, which is less than 30%. So, recently in August last year, in 2024, the Ministry of Health has introduced HPV self-sampling as the primary screening method for cervical cancer in Brunei. Before we launched out this program, there was a pilot testing to see how is the response of our women population in Brunei, and because it was an encouraging response, So it was launched in August 2024. And so far there has been a very good uptake of this program. And with the launching, there is also the National Cervical Cancer Prevention and Control Guideline, which emphasizes the use of HPV DNA-based testing as the primary screening tool for early detection among women aged 25 to 65. Okay, so our colorectal cancer screening, there was, according to the BRUMAP NCD, we had launched a new target for how many, what percent of our population should be screened. I'm sure with every other colorectal screening around the world, uptake has been quite poor, about 2.6%. So, and our breast screening uptake is actually about 21%. But we have done a very good job on the cervical screening, because the latest figure has shown us that 66% uptake on the cancer screen of the cervical cancer screening. All the screening program has initial entry points at the health centers and also Well Women's Clinic and also in the early detection cancer prevention services. Because of the relatively poor uptake, there has been an integration into a BRUMAP, into a mobile apps in order to recruit more people for screening. So our mobile map Bru Health was actually introduced during the COVID time, mainly used for contact tracing. More than 300,000 of our population in Brunei actually has mobile phone. So it has been one of our success story from Brunei, in which there has been, during the COVID, there has been a rapid digital revolution where we, digitalization in which the Bru Health has been initially launched for COVID-19 monitoring. Now we actually use it for population health, which is with a summary of personal medical records, including health education, and also and you can enroll yourself into the National Health Screening Program just at your fingertip. And after that, we have expanded the use of the Bru Health for enhanced personalized health index, and also where you can actually adopt a digital card to achieve your health goals. So the entry points, so what you need to do is that the users have to complete questionnaires, which will give recommendation to undergo for screening if they're eligible. So because of this, now everybody can access breast screening, cervical cancer screening, and also colorectal screening. So the next step is on the part of our cancer care continuum, our oncology services. Next slide. So our oncology services actually started in 1997. So our initially started as services, which turns out to a unit, and our 30-year journey, almost 30-year journey, has enabled us to now being having our own specialist center. Which is actually in cooperation also with the Brunei Neuroscience Stroke Center. Okay. And also, it was the oncology services in Brunei has also, it started with a government-based service, but now eventually it becomes a government statutory body. So this is our Brunei Cancer Center, which is actually situated by the South China Sea. Our treatment facility, prior to 2016, we do not have all the cancer treatments in Brunei. We used to send our radiotherapy, our nuclear medicine to Singapore, to Malaysia. But since the establishment of our own building, and also in 2016, we set up the radiation oncology services, then followed by the nuclear medicine services in 2018, and also we have had we have also improved on our medical oncology services in Brunei. Okay. In terms of early detection and prevention, yeah. So the early detection and cancer prevention services, It's actually Brunei's first dedicated center for early cancer detection, which we were established in November 2019. So our role, being in the government statutory body, but actually providing services for the community. So the cancer screening that we do in EDCP is actually subsidized by the government. Having said that, all the screening programs in Brunei, including the all the breast cancer, colorectal cancer, cervical cancer screening, they're all free to our citizens. So our role is actually to help strengthen the national health screening program, and also reaching out to the high-risk groups before the cancer developed. So we have a very good relationship with our oncologists, where we actually screen the high-risk family, especially with genetic mutations. So we're built on 100% collaboration with the Ministry of Health, and we also partnering to support Brunei's cancer control efforts. So what we offer in EDCP is that we do a very comprehensive cancer risk assessment, actually to identify these risk factors early, and we give personal education and also personalized care pertaining to the background of the patient. And we have also targeted screening, in which we enroll those who are eligible for the national screening program. And we also facilitate genetic testing, although we are not, we don't have the full infrastructure. And our main emphasis also on education, in belief that we can empower our patients for them to take the initial steps. So we cannot stand alone. So Brunei is relatively new in this matter. So we have a lot. We are establishing a lot of collaboration with many of our stakeholders. Ministry of Health being our regulator. Just to share with you that in order to increase cancer awareness, we've also engaged some of our locals, our celebrity for the World Cancer Day, and also the government ministers to attend our Cancer Day events. Just to show you some of our activities. So our ongoing challenges and gaps. Okay, as per other countries, I'm sure there's late presentation of cancer cases, low screening uptake despite it being a free service, engaging stakeholders, there's a lack of involvement from all levels, and also there's no advocacy groups in which a lot of this cancer control is actually run by the government and also by the Brunei Cancer Center. So there's also the persistent misconceptions and stigma, limited local data on our cancer risk, and of course the workforce and capacity gaps as well. Being a small country, we have a lot of things that is not yet fully in place. So our strategic plans for the future. So it's actually, our target is to make cancer prevention and screening everybody's business at the community level, primary healthcare level, secondary healthcare, and also the tertiary level. And this will start by developing our national cancer control plan to be more coordinated in our approach, and also increase our screening uptake. We've also engaged schools and also workplace in order to make them more empowered, and also to enhance stakeholder engagement. And also invest in capacity building, including research and development, which is very much lacking, and empower our high-risk populations. So this goes the education so that they can become, they can take action, and also leverage on data and technology. I think that's all for my presentation. Thank you. I'd like to acknowledge the Ministry of Health. Nice one. Thank you.
Thank you so much for excellent. I have to commend you on the cervical cancer, 70%. This is a great achievement, and I think now we're going to have the panel. We'll ask both speakers to join me here so we can have questions and discussion. So please, correct, boss. You have to know I arrived like 1 a.m. to my room, so jet lag. To me now in Doha is I'm still drinking my morning coffee. So this is my waking up coffee.